name came up. Hey guys, it's Jamie and Christine with Iowa Diabetes. We are here, excited. It's travel season. So we want to get you guys ready to understand how to travel with diabetes.
Right.
So we've prepared a list of tips for you. We're going to talk about how to prepare when you're traveling with diabetes, a list of common items to bring.
Yep.
And then tips to navigate special situations, like what do you do with the airport? What do you do like if you get sick and you're traveling?
Right.
And how do you handle some of life when life throws things at you? So as you join us, please send us a little hello, hi. After the fact, if you're watching it and we're not live, go ahead and still let us know that you're watching it. And then add your questions. We will respond to them. We actually have a pre-submitted question from Roxanne. Roxanne, if you're watching this, we are going to answer that. We're going to save it for a little bit later, one of those special situations.
And I do want to make sure we touch on, too, how to avoid complications when you're out and traveling. I can tell you, I've seen many of patients who go on vacation, and they have some pretty serious complications, dehydration, DKA. So we really want to go over how to avoid those things as well, because that can be pretty scary, especially when you're not at your home base, you know?
Yeah. And we've got Roxanne on. Hey, Roxanne, I'm glad you could join us. I will definitely answer your question. So things to make the trip, how to prepare so that you can be easier. Pack in advance. Don't be like me and pack the day of.
No, make yourself a list. That can sometimes be helpful. Don't just be like, think about it, then put it in there. Like, really have like a list of what, and we're going to talk about that list right now, right?
Yeah. And also like getting your medicines filled early. So if you're going to run out of medicines halfway through your trip, you want to make sure that you're starting early, because there's different things that a pharmacist may have to do. And it may take more than one day to get your medicines filled. I would start on that 1 to 2 weeks early.
Right. Because you don't want to be having to like ruin your vacation by looking for a pharmacy and getting medications refilled. And no one wants to do that. So bring extra of your medications, because sometimes things, especially since COVID, oh my gosh, as far as delays at airports and flights getting canceled, bring extra.
I usually recommend to bring double of what you think you're going to need. Bring double test strips, bring double medicines, all of those supplies. Also, snacks. We want to make sure that you're packing snacks, getting things ready, and having those snacks ready for the go. So my biggest recommendation, watch the video on how to snack on the go.
Oh yeah, we do have to do that one. You know what? Not just with snacks though, like the biggest thing that my patients have issues with is not drinking enough water and, hydrating on the trip. You're on the go, you're going from place to place. And remember, when your blood sugars are high, you're spilling out extra sugar into your urine. Well, water follows that. So you're actually at higher risk for dehydration. And so it is so important as you're walking around, looking at sites, traveling, you need to be drinking plenty of water, because that's one of the biggest issues with complications is not getting enough water.
And we have an article coming out on handling diabetes in the heat, and it's water, especially if you're at the beach, right? Doing maybe a little sunbathing, laying out by that pool. You're going to be sweating. You're going to be getting rid of that. And that could itself spike up your sugars as well.
And it's not just water, the G2s, the Gatorade Fits. I mean, there's other beverages with electrolytes. You maybe even want to mix it up a little bit, because as you mentioned, with being outside in the summer and sweating, you can lose electrolytes, which can cause some muscle cramping and so forth, which can even lower those blood sugars even further. So
yeah. And now getting to those lists of what to kind of we've talked about the meds, but it's all those other supplies. Your list: glucose test strips, the lancets, the glucometer, or your CGM. If you're going to be outside, bring extra sensors. I just got back from a diabetes camp. These kids were outside all day long. You're sweaty. You're putting on sunscreen. It's gross, it's slimy, it's sweaty. We lost sensors and pumps left and right. Bring extra of those. Expect that they will fall off. Bring alcohol swabs. If you're going to test your sugar or inject insulin and you're hot outside,
Right.
you may not have the ability to wash your hands or wash that area. So bring alcohol swabs.
Yeah, that's a really good one. You don't want to get an infection on top of.
Again, you're at risk for those highs, but you're also maybe increasing your activity, doing some different. Got some pop-ups going on.
Yeah, we don't want no pop-ups.
Doing some different walking activities, hiking, and so bring fast-acting sugars. Fast-acting sugar, I like to show this. It's just a roll. It kind of fits in your purse. Fanny packs are now back in style.
They really are.
Your fanny pack. And if you start to go low and it's less than 70, you just chew up 4 of these. Boom, your low blood sugar hopefully is fixed.
Yeah, and then maybe some peanut butter crackers or cheese crackers, something that's going to help maintain that. If you just do the glucose tabs, but then you're still on the go, you're really at risk of dropping low again. So you want to try to maintain that blood sugar, and that's going to be like more of your complex carb, fat, protein combo.
Yeah. Other things, bring supplies for those glucometers, whether it's extra batteries. If you're doing a sensor, bring in your charger, right?
Yeah,
if your sensor doesn't get charged, so just like we have to bring cell phone chargers everywhere now, sensor chargers too. Other things I would recommend is bring a list of your doctors and your contacts, because in case something happens and you're like, I just can't get my blood sugars down, or I just can't get my blood sugars up, you can call them. A list of your medicines, a list of your doctor's phone numbers, all of that is important to have when you're traveling.
And with that list, most people aren't necessarily traveling alone. If you are, you want to have some kind of identification that you have diabetes. But if you are traveling with people, make sure the people around you know. So that way, if something does happen, if you lose consciousness, they're able to let, those paramedics and providers know, like, this is probably one of the reasons, and they can treat you appropriately and more quickly. So make sure that everyone around you is aware, like, just in case,
this is what happens.
This is what's going on. Yeah.
So the other things is, like, let's talk about traveling on the airplane. Getting through security is a huge step. So how do you get through security safely? They've got some different websites for TSA on how to get through with your medical supplies. So do check out that website.
One of the good tips that you had talked about was, everyone's like, oh, you can only bring a certain amount of liquids and you're not allowed to bring that. But actually you can bring your insulin, and you actually don't want to put it underneath the plane.
No.
Because those pressure changes and the temperature can actually ruin your insulin and some of your medications. So I liked that suggestion, is you actually need to bring all your medications with you on the airplane.
Right. You have to keep them. And because that underbelly of the plane gets super hot, super cold, and insulin does not do well in those different temperatures. No. We've got some different people who have joined us. Sherry, Lori, thank you for joining us. Love seeing familiar names.
Thanks, everybody.
So keep that medicine, keep that insulin close to you in a backpack. I also say don't put it up in a bin. If you need a treatment while you're on the plane, keep that close to you, either in a purse or the backpack that goes right underneath the seat in front of you. We don't want you or having to fumble over people in order to get to it.
Opening the bin, knocking people out.
All that situations. It's no fun, airplane travel. Other things, I always recommend to bring a letter. If you're nervous about traveling with an insulin pump, a sensor, or even with your liquid insulin, have your doctor or your provider write a letter for you and say, I've got diabetes. Here's why I need to have all these supplies with me.
It is medically necessary that you have these things on the airplane. And every provider is happy to write that.
Yeah. And then bring everything with in a clear plastic bag. It's and all of those things can go through security quickly, easily, as long as they're separated in that clear plastic bag.
Now, isn't there something about the x-ray machine?
There is something about the x-ray machine in terms of like an insulin pump or a sensor. Those don't necessarily have to go off your body. They will have to be inspected. They will have to be looked at a little bit separately just to ensure that there's no explosives in it. But as soon as they can do a hand x-ray on that, do an explosive test, then usually they'll go through TSA. And that's why get there early for all of these things, because it does take a little special attention. You don't want to be running late and having to go through these extra things and rush TSA.
They don't rush.
They won't.
Do those words go together?
No, unless you have the pre-check, right?
Oh yeah. Maybe something to consider.
Yeah, with the diabetes, maybe
Right?
something to consider is
Uh-huh.
paying I think it's like $50 or something depending on the number of years that you get it. So Roxanne, we're talking about sensors. Let's go ahead and answer your question. You have a question about using a Libre 2 when you don't have internet access. My understanding, if you're using the app, you don't need internet to use that app. So you open that app and it's doing a close connection communication with that sensor that's on your arm. So you shouldn't need internet to use that. The sensor will still be accurate. Now, what needs internet is sending all of the information to the cloud. That's not going to happen until you're back in connection with internet. But you still can check your sugars and get that data and remain safe.
Which is like the main reason to have it right there, for sure.
Yep.
That's a really good question, though.
It was
Really
a
good
great
question.
question. I loved it that you brought it. Other things, traveling abroad. Tips for traveling abroad. What have you told your patients?
I mean, one, the medications we talked about, like that's a big deal.
Yeah.
But another interesting tip is, if you're a different language there,
Yeah.
learning some basic things like, I have diabetes, I need juice.
Yeah. Yeah. I thought
Yo tengo hambre, necesito.
I have diabetes, low sugar.
Yeah.
Like food, whatever it is that can help you get to what you need in an emergency situation.
Right.
I think just traveling around the United States, especially if you're in the US, you might be able to find medical care or a pharmacy, and it's being aware. I had a patient who just could not get his supplies refilled early. We worked and worked ahead of time, couldn't get it done through his insurance. So he mapped out on his trip where a pharmacy was ahead of time and was with it enough. And I kind of helped get prescriptions called in ahead of time for him so he could just drive in and pick things up. I think that's convenient. And now that all these pharmacies are kind of located, the big chains are connected together, you can do that. Abroad, that's going to be a problem.
Right. But at least identifying where like the nearest medical center is in relation to where you're staying. So just in case there is an emergency, you don't want to waste extra time by trying to figure out where you should go.
Right. Yeah. Other things like what happens, Christine, if they go to Mexico and have Montezuma's revenge? If you've ever heard of that. What if you have severe food poisoning from some of the local food that could happen? What do we do?
I mean, that's obviously going to affect your ability to eat and your blood sugars.
Yeah.
So one, look at doing like the brat diet. And I like to call it the brat-y diet because I kind of add yogurt because as your GI system is flushing that out, there's that bad bacteria. We want to reestablish it with some of the good bacteria. But so what is bratty? Bananas, rice, applesauce, toast, obviously bottled water at that point. And then really more closely monitoring your blood sugars. Is going to be a big deal because for some infections, your blood sugars will actually go up. With other infections like that, with the dehydration, I think they can really go down.
Yeah.
And then if you're not getting all the nutrients because things are going through so quickly.
Super fast. And so I think that's absolutely right. And that's why we say double your testing supplies. In that situation, we want you checking every hour, every 2 hours until your sugars are maintained, until you're not emptying out everything in your system.
Exactly.
It happens, guys. It happens. Hopefully it doesn't happen often, but it does happen. So those are all of our tips. If you guys have different tips that you have used as you're traveling, let us know what they are. We want to hear it.
For sure.
You can help each other out and let each other know what you've done.
Exactly.
Thank you guys for joining us. It was a quick, easy one today. We've only been on for about 15 minutes, but this is the quick one. We've
and-
got an exciting one coming up about
we do.
exercise.
That one's going to be fun for sure. You might even see Jamie and I doing some moves.
Doing some moves. We're bringing
Are we
in
doing?
a-
Are we like doing like a Roomba or something? Or
Ooh, I hope not. I hope
Just
there's no
kidding.
dancing.
I'm just kidding.
We're bringing in a fitness expert that we've worked with in the past, Jen Wagner. She's going to come talk with us again about finding our favorite form of exercise.
And if you guys have any questions that we didn't answer, once again, please post them below, and we'd be happy to answer those for you.
Thanks for listening
Bye,
in.
everybody. Have a great week.